Now, concern is rising over a new COVID-19 variant, EG-5 or Eris. This week it became the dominant variant in the United States. The World Health Organization has classed EG-5 as a variant of interest. For more, we're joined by Faculty of Health Sciences Dean at Wits University, Professor Shabir Madhi. Prof. Madhi, great to have you with us, as always. It does sound like we've seen before, which is more infections perhaps, but not necessarily more deaths. Is that correct?
Good evening. So that's very much correct. The one issue in South Africa is that the amount of testing that's been done is fairly limited, especially for mild cases. But given when looking at hospitalization, there hasn't been much of a change in the number of individuals being admitted for COVID-19 almost for the past 12 months, which is a really positive thing. This particular sublineage of the Omicron variant, which was really the parent variant that has resulted in multiple sublineages, more than 200 sublineages evolving since it was first identified in South Africa, does indicate that it should be a bit more transmissible than other variants and might be what we refer to as antibody evasive. But for all intents and purposes, it's extremely unlikely to cause any surge of severe disease cases in South Africa as well as elsewhere, simply because of the large number of people that have developed now immunity, either from infections or through vaccination.
So you've preempted a question. As South Africans, can we rely on our natural immunity? I mean, a lot of countries, a lot of companies, the whole idea of vaccination has sort of fallen off the agenda, especially for young people. So are we good to go?
We're pretty much in a good position, except if you have got some sort of an underlying medical condition, or if you're about the age of 60, 65. If you haven't received a booster dose of vaccine in the past 12 months, that certainly would be recommended. But for the general population, there's very little reason to get a booster dose of vaccine, and particularly with a type of vaccine that we currently have in South Africa, which is really still targeted against a wild-type virus. There is a new vaccine that's coming out that will be much more effective in preventing even infection, at least for a certain period of time, due to the EG-5 variant that's currently circulating. But that vaccine is unlikely to be available in South Africa in the foreseeable future.
You suggested that there are many variants circulating together. Are we doing enough testing to actually know what's going on in South Africa so that we know that this is the biggest variant in the United States? Do we know what is even dominant right now in South Africa?
Yeah. So even in the United States, the EG-5 is only responsible for just under 20% of all of the COVID cases. So there's a number of other variants, all related to the Omicron variant that have been circulating concurrently. In South Africa, we haven't been doing too much testing, so there's very few samples that have been sequenced to determine exactly which variants are circulating. But to some extent, that's no longer that important. I think it's important for us just to keep an eye on the number of people that have been hospitalized for COVID-19. And certainly if we do see a significant upswing in cases, then we might need to become a bit more intensive in investigating as to which variants are circulating. But right now, we are in a good space, and certainly over the past 12 months, the number of people that have developed whooping cough, even adults, as well as the number of people that have developed influenza, flu, has been substantially higher than the number of people that have developed COVID-19. So COVID has really settled in and is sort of part of the different viruses that do circulate.
All right, so it's now just part of life. I mean, how does the death toll, do we know right now, if we compare it to flu, say, that you mentioned?
I think this year there's been more people that have died of flu than of COVID-19, based on surveillance that we're doing at Kasani Baragwanath Hospital, and also looking at NICD surveillance. Certainly we had quite a protracted flu season, which has now subsided, but the flu outbreak this year was substantially higher than the COVID-19 cases, and particularly in children, as an example, we saw a significant amount of children being hospitalized for influenza, for another virus, known as respiratory syncytial virus, and very few children that were being hospitalized for COVID-19. And the same thing probably applies to adults.
All right, so The flu is more dangerous right now, and you don't seem too concerned about the new COVID variant. I mean, there were fears that COVID could mutate along the line, especially in those who had immune deficiencies. Is that no longer the fear because it's been a while? Is this how things are going to play out?
No, so those mutations are ongoing, and that's the reason we've got this new sublineage of the Omicron variant, the EG-5, is a sublineage of Omicron. And there's been more than 300 sublineages of the parent Omicron that was first identified in South Africa. So it will continue mutating. And although these mutations result in an evasive to antibody that protects against infection, there's another arm of the immune system known as cell-mediated immunity, which has remained relatively intact. And that is what generally protects against severe disease. So even though we might be having infections transpiring, we have very few people being hospitalized because this sort of mutations that have taken place are not really affecting the cell-mediated immunity, which is protecting us against a severe disease, and appears to be more long-lasting in protection than what you achieve just from antibody.
All right, we appreciate your time and the reassurance. That was Faculty of Health Sciences Dean at Wits University, Professor Shabir Madhi.